Good afternoon and welcome to today's webinar presentation entitled Practice Sharing Waterloo Region Youth Champions Initiative. My name is Selena Degano and I'm a Senior Program Specialist here at Public Health Ontario, and I have the pleasure of moderating today's session. I would like to start this webinar by acknowledging that we are all participating today on traditional lands of many nations, which they have inhabited from the beginning. Those of us that are settlers are grateful for the opportunity to live and meet here, and we thank all the generations of people who have taken care of this land for thousands of years. I am personally attending today's session from Toronto on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. I ask us all to commit to working together in the spirit of trust, respect, and reconciliation. Now, just to go through a few housekeeping items for today's session. So to ensure an engaging and optimal experience for all, the Zoom chat and audio and video features have been disabled for today's session. This session will be recorded and available in a few weeks following the session today. We have held 90 minutes for today's webinar, but the length will really depend on the amount of questions and discussion at the end of the session. And if we do run out of time, there will be an opportunity to answer questions offline or if there are questions following as well. Thank you to those who have submitted questions in advance through the registration form. We'll be going through all the questions following the webinar presentation. And for those that have questions during the session today, you can go to the bottom of your Zoom and you can look at the Q&A pod and click on there and post questions at any point during today's session. And as I mentioned, we will try to get through as many questions as possible after the presentation. For any technical issues during today, please email capacitybuilding@oahpp.ca, and capacity building's all one word. And now I can move on to introducing the speakers. So it is my pleasure to introduce our speakers for today's event. We have Heather Berry, Ruth Cordukes, and Tonya Clark, with Jonathan Mall joining us at the panel and discussion at the end of today's presentation. We have Heather Berry and Tonya Clark joining us from Waterloo District School Board. Heather Berry is a safe school and mental health consultant, and Tonya Clark is a secondary school teacher. We also have Ruth and Jonathan from the region of Waterloo Public Health and Paramedic Services. Ruth is a public health nurse in the substance use prevention team, and Jonathan Mall is a manager in substance use prevention. So I'd like to welcome you all to today's session, and I'm going to pass off the presentation to Ruth, Tonya, and Heather.
Well, welcome. Thank you for joining us today. We wanted to start by talking a little bit about why Region of Waterloo has focused on youth substance use prevention using a youth engagement peer-to-peer model. So according to the Center for Addiction and Mental Health, young people aged 15 to 24 are more likely to experience mental illness and/or substance use disorders than any other age group. The prime period for prevention programs is between the grades 7 and 10, as this is the most likely time that youth start using substances. Prevention programs that include youth engagement and peer-to-peer models, they have lots of positive outcomes for youth. So for the youth who are actually the peers delivering the program, it has the potential to enhance their skills, build their self-esteem, their sense of well-being, build personal growth. And for those who are on the receiving end of education from their peers, there's lots of things. So it can boost resiliency, it can give a sense of belonging, they can learn important coping skills, and of course, they can learn health information that they can draw on when they're making important decisions. And when they receive it from their peers, they are going to receive messages that are tailored for them because peers are in the best place to know what youth are concerned about, what's important to them, what they want to know, and what they need to know. The Youth Champions Initiative, it was a new initiative for Region of Waterloo Public Health, and we started by aligning the goals of public health and our two local school boards in terms of substance use prevention. And I have to say, and I say this a lot, the Youth Champions Initiative literally could not have happened without the cooperation of our local school boards. The Waterloo Region District School Board, who's represented here today, are just outstanding partners, and we're so grateful for them. And this work together has resulted in a successful multi-year initiative. We're now starting year 4. In 2019, school board reps approached public health and said they had concerns about cannabis and vaping use. No surprise there. And this aligned with public health's concerns about youth substance use. So we agreed to enter a partnership to try and address this issue. We were inspired by the RNEO's Youth Champions Initiative, um, and we developed one with the school boards for our region. So we proposed a model that the Youth Champions Initiative would be run within the school board's school settings. And this model would train youth to deliver peer education around substance use prevention and mental well-being. And in this model, both youth and their secondary school staff supports, Tanya is one of those for several years, thank you, Tanya, that they would be trained together in order to engage other youth for preventing and reducing substance use. So we had kind of a weird, I don't want to say if it's lucky. There was a weird coincidence that as we were talking about this, of course, the provincial government released funds through the Ontario Cannabis Legalization Implementation Fund. Those went to municipalities, and our municipality channeled some of those funds to public health. And then public health decided that they would allocate a portion of those funds to this initiative, which we're very grateful for. So as both our school boards have very unique needs, we work separately with each school board in developing a Youth Champions initiative so that it could meet their specific needs. And as I said today, we've got Heather Berry, who is the mental health lead with the Waterloo Region District School Board. We also worked from the board with their Safe and Healthy Schools consultant. On the Catholic side, we worked with their mental health lead and we worked with their healthy active living consultant. What is common to both of the school boards are some fundamentals. And so, of course, it's based on the concept of youth engagement and peer-led activities. So at the beginning of the year, schools needed to be recruited, staff leads from those schools needed to be recruited. Then you needed to recruit youth champions, and then you needed to train them together. The goal was that after that training, school staff would then be in a position to help them to provide support, help them implement activities, and really let the youth lead. And Tanya is an excellent example of that. Youth champions would deliver substance use prevention content to their peers in the form of games and activities, events, as well as using promotional materials like posters throughout their schools. And the fundamentals of youth engagement, it really means being true and faithful to the principle that we involve them in decisions that affect them or that they think are important, that we gather their feedback and we listen to it. And for example, in this initiative, really listening to them in terms of identifying games and prizes and posters was really helpful, really, really helpful. The topics that we focused on included cannabis, vaping, alcohol, other substances, including opioids, and youth well-being. There was also messaging related to resiliency and coping skills, because those are important strategies to help youth refrain from using substances. Wherever possible, we utilized existing campaigns, and we relied heavily on the Use Your Instincts campaign that was developed by Ontario Public Health Units. And more recently, we've also added the Not an Experiment campaign, also developed by Ontario Public Health Units. And of course, we rely on Health Canada and KMH for messaging.
Hi, thanks. So, my part today is to talk about our school board involvement and role. And this youth initiative, Youth Champions Initiative, has been such an integral part to a lot of the learning that our students are doing and aligns beautifully with several of our strategic directions of the WRDSB. The first one is supporting student well-being. The Youth Champions Initiative provides youth with the knowledge to prevent substance use, how to use more safely, the interconnectedness between mental health and addictions, and very importantly, how to seek help for cessation. Another of our strategic directions is strengthening connection through community engagement. And this has been an excellent example of that. And I just am so thankful for this partnership. It has been just incredible for not only our staff and students alike, but just deepening a connection between a school board and public health. Many of our students might never have connections with public health in their school career if it were not maybe for vaccine clinics. But this has been a really special partnership in the sense that students get to understand the preventative work that public health does and how it helps them thrive as young people in our communities and have a healthier life. This will inevitably help their learning, right? And have them live better in a learning ready body. Another part of our strategic directions is, of course, increasing student learning through engagement. And there has been multiple opportunities for our students to give their feedback about the Youth Champions initiatives before it started, to sort of align it with the things that they needed to know. And of course, afterwards to, make any types of corrections that need to happen for the next time we run the program. And it's just been an incredible way to have students learn through engagement. It also meets the Ontario Ministry of Education's 2022 to 2025 Mental Health and Addiction Strategic Plan. In particular, the new PPM 169, Student Mental Health, which states its purpose as such. The Ministries of Education and Health are committed to working collaboratively to build a continuum of mental health and addictions care across schools, community-based child and youth mental health providers, and hospitals that is coordinated, comprehensive, and responsive to the needs of each and every student. And I really believe that this program aligns beautifully with this new PPM. PPM 169 stipulates as number one of its 11 recommendations that school boards will develop a 3-year mental health and addictions strategy and a 1-year action plan. And our annual action plan this particular school year has 4 priority areas, which YCI neatly fits into 2 of them, which I think is pretty spectacular. Goal number 1, student engagement and partnership. As experts on their experiences, we want to engage students in the development and leadership of student wellness activities. YCI certainly allows for that. Goal number 4, collaborating with community. Coordinated responses to emerging student needs. We are fortunate to have a very effective and passionate public health team in Waterloo Region. As needs emerge, it is important to work together as a community to respond, leveraging organizational strengths as well as the power of collaboration. And I think this is a beautiful example of that. Lastly, we have been able to prioritize this work in very much thanks to Waterloo Region Public Health and the grants and fundings that they have received, which allowed for us to begin this work initially. And our board continues this work as funds, perhaps for this particular piece, no longer lie with public health and have come to us through the Ministry of Education Emerging Needs grants that are specific to substance use and intervention around vaping, cannabis, and alcohol use. And I think I'm going to pass it to Rick. Yes.
Oh, thank you, Heather. Oops. Okay. So after months of planning, obtaining resources, recruiting secondary schools, and identifying school staff leads and recruiting youth champions, the initiative was implemented in the schools for the first time in September of 2022. And implementation began with training of the youth champions and the staff leads together. Heather, I'll send it back to you.
So the picture on this slide was taken at a Youth Champions Initiative in our coterminous board. The school staff leads and the youth champions are trained together for the entire training as staff time is really difficult to obtain. There's no question about it. And this has been an excellent way to do the work together. It allows the students to be leaders and the educators to align with the goals that the students have to take the information that they've learned back to their schools with some excellent mentorship and guidance from those educators. The location has taken place in a variety of different spots at the WRDSB. We have a lovely facility where we're often able to have students here in-house. And if the space is not available, we have an excellent family center, which is available for rent that is close at hand, so students can make their way there. And I do love coming out of their schools, but I think at our coterminous board, sometimes the Youth Champions Initiative also happens at school sites. And it's neat for students to see different schools as well. So there are some costs, of course, included. The biggest one being staff release time. It is quite costly, and of course, this is where the majority of funding goes. And so we are very thankful for the funds to release our staff so that they can support our students. And this is an incredible way to make certain that prevention is happening. Transportation is another cost. We at the Waterloo Region District School Board are able to move our students from school to site, and we do that generally through taxi, and we can talk about logistics and how that works later on in this program. Food, students come to space and we provide breakfast and lunch. And then, of course, the costs in games. So the games are things like a spinning wheel and, of course, beanbag tosses, etc. Prizes and promotional material, which are really important because if we want to engage students in space, they love winning a particular prize. So that has been essential in gathering the students as our young students present things throughout their sites. Cannabis municipal funds are available to pay for training, so teacher release time and food, games, incentives, promotional materials, celebration at the end. So we like to have the students come back to tell us how they've done and what they've done. And it's been wonderful to see the amazing things that they're creating. And the goal of training, of course, is that the youth champions leave with an understanding of their role as advocates for prevention and how to use the resources. And then, of course, at the event, they want to have one activity planned. So there's some time at the end of the event so that students can plan for those activities and take those back to their school, ready to use whenever they have a moment to do that. So the staff leads are, again, there to assist in planning and thinking about when the right time would be to present these materials in their school site. And that training will include all of the goals of the YCI, the role of the staff leads and the youths, learning how to facilitate the games with their peers. They get to have an amazing time trying out all of the activities so they feel confident when they return to their space that they know how to use each of those engagement tools with their own students. I think lastly, the planning time is really important, right? Planning time is really, really important so that the students have an opportunity to plan so they do feel confident, a really important part of this whole process. And I'm going to pass it to Tanya to talk to you specifically about how she does that at Forest Heights Collegiate Institute in Waterloo Region.
Thanks, Heather. Good afternoon, everyone. I've had the privilege of being involved with the Youth Champions Initiative for the past 3 years. And so Ruth and Heather asked me to speak to the role of the school staff lead and just go through the process that I've been through with leading our youth champions for the past 3 years. So the first step is obviously to recruit the youth champions. And in my experience, I've been very fortunate because I work with a group in our Safe, Caring, and Inclusive Schools Committee that each school in our board has at their schools. So I'm already working with a group who is really passionate about creating positive spaces for their peers. And so at one of our meetings at the start of the year, when we've been given the go-ahead, I introduce the concept of the Youth Champions and I provide some information to them about what the program is about. What's been really interesting is because this is the third year, there's already a lot of knowledge and enthusiasm about the program, and students are already aware of what happens, and so they're very eager to take place. And we ask for volunteers, and I think that is very, very important that the Youth Champions volunteer to be part of the program because we want them to be passionate about what they're doing, and that is shared with the students and their peers that they interact with. We here at Forest Heights typically get students in grades 10, 11, and 12 simply because they are often going into grade 9 phys ed classes, and so it's nice if they can be just a year older than the peers that they're working with. But of course, if we had a really passionate grade 9 student who wanted to do it, we wouldn't say no to them. As a teacher lead, we then help support the youth champions in a variety of ways, and the first of which Heather touched upon. The staff leads go to the initial training, which is really great because we get to participate in all of the games. We're part of the activities, any of the new information that is presented. We are right there with our youth champions learning that together. We interact with the other schools, so that's been really nice too, to see the various schools that come together at the start of the year and are very enthusiastic about the program, and just to hear the ideas from the various students, youth champions who are participating this year, because each year students come up with different ideas, so it's really nice to be able to share those and kind of get inspired ourselves. And then, as Heather touched upon, we have some time to plan together during that day because everyone's very enthusiastic, and so it's nice to be able to get right into it, dig right into what we want to do for that year and to kind of come up with some ideas, but definitely have one event that we're really ready to take forward as we leave that first initial training. Again, when we're talking about the brainstorming and the planning, the teacher lead is there to help facilitate, but we take a back seat because we really want the youth champions to be really enthusiastic and engaged about what they want to do. And when that happens, again, the passion comes out and they get so excited about being able to come back and facilitate these events at the school. At Forest Heights, we meet a variety of times throughout the year, and we use those times to plan together. But we provide support to the youth champions throughout the year and when they are facilitating the events. Also, Ruth and Heather have been so kind and generous at coming to support our events as well, because we like to have an adult present. Again, we take a back seat so that the youth champions are the ones running the stations, but we're there in case there are ever any problems or issues. And again, just to be able to answer questions that they might have. Teacher leads also keep in touch with public health. And so certainly in the first couple of years, Ruth and I were in touch at a variety of times throughout the year. And I just want to say she was so great at hearing feedback from the students, which was so empowering to them because they had a lot of ideas, especially in the first year. We had some really enthusiastic senior students who were running, but I think too, because it was the first year the program was at our school. And so they had they had a lot of feedback to share. And Ruth was just wonderful at listening to that feedback and taking that back to her team. And they could see that they used that feedback, which again was so empowering for our youth champions. So I would help facilitate the meetings. I would set up the virtual meetings, but then the students would take over. And Ruth was just fantastic about always giving them voice and having them feel seen and heard. We also safely store all of the games and booklets and activities that have so generously been provided to us because, as Heather said, that there is a big cost in those. And so we make sure that they're safely stored so that students are aware of where they are and what they have access to. Also, the prizes are such a highlight for the students who are participating and coming to play the game. So we make sure that those are stored safely. And then finally, we help to coach the youth champions if they do encounter any difficulties or if there's any issues that arise and they feel that they would like to have addressed. We just make sure that they have a safe place to share that information and that we pass that to the appropriate people. And I just also want to shout out Heather Berry at the school board because she has been a huge source of support and will come and support me as well as the youth champions whenever we need her. So it's been a wonderful team. It's been a wonderful experience, and I'm just very grateful to have been a part of the program. Thank you.
Thanks. That is, yeah, just an incredible educator. If we just stay on this slide, we'll walk through these different Youth Champions Initiative activities, just highlighting the incredible things that our staff and students are able to do. This particular photo is an activity that one of the students came up with, and Ruth and our public health team are always encouraging the kids to kind of add to, what do you think a new game might look like, or how does this feel, or what do we need to take away or add in? And as Tony said, those changes are made very readily with taking the students really seriously, and they do appreciate that so much. So some of the things that our youth champions have done are grade 8 nights. When grade 8 families and students are coming in, they'll have a setup to teach them about safer use or prevention of cannabis and vaping. They may do parent nights, which is very brave. I did attend a parent night as well at Forest Heights, and I was so impressed by the students and how they interacted with parents, which is really fantastic and allows parents to kind of think about, oh, I actually could have a conversation about this with my own children, which is just beautiful. They get to try it out on someone that's maybe not their own child. The interactive games and displays, of course, all throughout the school. They have morning announcements like little trivia tidbits or sound bites about vaping and cannabis prevention and maybe cessation. They have classroom education. As Tonya mentioned, the students are going into grade 9 classrooms. They're going into MLL classrooms. So some of our newcomer students are also being receiving information from our youth champions. And they're supporting our feeder schools. And what better way to send prevention information by, older kids coming into younger kids and presenting information that they're going to take very seriously from them, much more so than from us. So really fantastic connections there. And then finally, there's lots of games supplied to them through the youth champions that have been created by youth champions and created by public health that are very engaging and allow for the students to sort of plug and play, take the things with them, put it together, and away they go. So just fantastic initiatives by these incredible youth champions. And I'll pass it to.
Oh, sorry about that. Okay. Thank you very much, Heather and Tanya. So this particular slide was taken as we were setting up for a year-end celebration event. And as was mentioned, closer to the end of the school year, in the past, we've held annual celebrations. And this is an opportunity to acknowledge the youth champions, to acknowledge their accomplishments, and to get to hear what they've done throughout the year. And this helps to inspire other schools, as Tanya mentioned, hearing what other schools have done. It helps to retain youth champions the following year. It helps to keep the momentum going. And it's a really great place to collect evaluation data. And it also provides an opportunity for us to connect with the staff leads in person, which is really nice. Ideally, of course, it would be great to hold the celebration in person, but sometimes that's not possible. There are limitations on the number of days that events can be held, and there's sometimes supply teacher issues. Sometimes rooms aren't available, and as Heather said, they get really creative. Sometimes it could be budget. So there's lots of flexibility, lots of different ways you can do this. You can do it virtually. You could go to an individual school to do the celebration. But as I said, bringing everyone together is the ideal. So after the celebration, public health and the school boards, we get together and we decide, number one, are we going to do this again? And that decision is based on what priorities do we have? How feasible is it to do that? The budget that we have, the dates that are available. And then once we've made that decision, and if we decide to go forward, which we have, luckily, we then revise the content. And that revision is really based on what we hear from the youth champions, number one, from the staff leads, from our public boards and Catholic boards. It could be also from the province. And we might be getting information about new and emerging issues that public health is seeing as well. And in terms of what we revise, we have booklets. We have staff booklets and student booklets. We have a guide on how to run activities. We have a guide that includes all kinds of questions and answers for the youth. These questions and answers can be used with any game. And that's really important because we want youth to have fun. And if they feel that they have to be the expert, that they have to know everything about cannabis and vaping and alcohol, you can see how that wouldn't be fun and that would not raise their confidence. So by giving them this information, they don't have to memorize it. It's right there. It means that, oh, this actually could be a lot of fun. I can get on board with this because they're not paid. They're not nurses. They're not teachers. They're volunteering to do this and they're really busy. So it's really important to make it fun for the kids. And we've learned that you need to listen to the youth over and over and over again because they know exactly what they need and they will tell you if you ask. So we also, as well, look at, as Heather mentioned, what games do we need to purchase, the hands-on games. And we create online games as well. And of course, we look at the evaluation plan. So evaluating the Youth Champions Initiative, it really is an important step in understanding the impact of the program. It's important for us to make improvements. And it's also important to help encourage other schools to get involved when they hear what we've done in the past, because it is a big commitment. The longer-term goal of the program is to lower rates of youth substance use and improve student well-being. So in addition to this, the program is also trying to strengthen youth resiliency, promote personal growth and identity development, broaden and strengthen social networks, enhance leadership skills, build positive youth-adult partnerships, and to understand youth perceptions of substance use and well-being. So these personal impacts are difficult to measure when we're talking about students because everyone and their dog wants to know what students think. And students are already answering a lot of surveys within their own schools. Um, so we have to be really respectful and follow the lead of our school boards in terms of what's doable and what makes sense. So although we don't have direct access to the students who participate in the activities, we do have access to the youth champions. Now, the youth champions and the staff leads are busy. They're very busy. So we made a decision that we would collect qualitative data when we were in the same room with the students and the staff leads. And I think that's worked really well. It has changed and evolved over time as we've gotten feedback. We do formal feedback in the form of surveys during the training and the celebration, but then we're also getting a ton of informal feedback. So for the first year, public health took the lead for the evaluation. And what we learned was that wasn't really the most ideal approach. So we're talking about institutions that have very different processes, they have different resources, they have different policies, and it really made more sense for the school boards to take the lead on evaluation, and mercifully and thankfully they said yes, and we're so grateful. And that's worked out, I think, really well. And I'm really happy because it also means that the school boards can really tailor it to make sure that they're getting the data that will really help them with their reporting needs. Now, of course, there are always limitations in evaluation. So the first one is that bringing electronic devices like tablets to a training with youth is not really the best approach, trying to keep them off tablets. So we made the decision that we would have paper surveys only. And the respondents had to complete the surveys while they were with us in the room because it's just too problematic to try and collect that data after the event. Some youth champions got very creative and they just gave a group response. So you have the limitations of that type of a response. And as I mentioned, we don't have data that was collected from the students that participated in the activities. But I know that schools like Forest Heights, like Tanya's group, they actively evaluate every single one of their activities, and they're always thinking, did we achieve our goals? What can we do better? Who did we reach? So we know that the evaluation is happening, which is what's really important. That's the most important thing. So in terms of what the youth champions liked best about the program, we heard lots of things. They liked learning about cannabis, vaping, and alcohol. They liked talking through problems with school staff, getting opportunities to try to solve problems. They liked getting involved with their school's community. They liked getting to see the students having a break doing their activities while also learning. They liked sharing info through fun and exciting ways. And they liked raising awareness on substance use to a wide audience, such as students, teachers, and parents. And I have to say, I was really very pleasantly surprised to see the youth wanting to connect with parents. I never anticipated that, and it's been fabulous. We've also heard from the youth that they really enjoyed having opportunities to speak up about issues that matter to them, like vaping, substance use, equity, stress, safety. Some of the schools created safe spaces for their peers to de-stress, like a chill and skill room. They liked having hands-on leadership and feeling real responsibility for planning events, which Tanya spoke to. So on this slide, you can see some of the hands-on resources that over the years we've given to the youth champions. There's a spinning wheel and a Plinko game that have cards with questions and answers on them that the youth can use, but they can use those cards with any game. The public board, they created a great alcohol goggles kit for each school, and it includes beanbag tosses and an obstacle course. It's brilliant. This year we purchased giant Jenga, and you can also see that we've got a coping skills bingo game though there. So we had those cards laminated courtesy of the school board and handed out bingo chips to the schools. And that game was created when we were at a celebration event and the youth shared some of the activities that they'd done and it included a bingo game. And we were like, that's a great idea. So yeah, just an example of how youth can really teach us. We learned that youth really value professional resources, like the Use Your Instincts campaign, like the Not Experiment. It really energized them and I think gave them confidence. It meant, as I said, that they did not have to memorize content. The messages were right there. They asked for more posters. Posters didn't get defaced. As we said earlier, games or prizes are really effective. The prizes don't have to be expensive. Little mini squishes were incredibly popular. So there's lots of ways to do this without breaking the bank. We learned that over time, it was really important to introduce new games, new resources, new posters, new messaging, new questions and answers, because the content changed and the youth gave us feedback. Those questions were a little too hard. We would like some for folks who don't speak English as a first language. So, oh, we really want to talk about opioids. So that kind of feedback really helped guide our changes. And what we found is that youth are really, really innovative. As we listen to them sharing their ideas and their activities, I was always surprised. They're so creative. So our focus was just giving some basic tools that they could just use to then go off and create their own. Heather, I'll just turn it over to you for this slide.
Great, thank you so much. So again, I think Ruth did a great job at looking at lessons learned. One would be school implementation. It certainly varies from school to school. Each school community is unique, and the youth champions that are part of the program are unique. So they come up with, we don't want to streamline or keep the activities exactly the same from each school. We want to make sure that we give the opportunities for students to create. They love learning about crossover, what's happening. The wonderful part about the planning is that they are able to hear from other groups at the share back part, what other schools are doing, and so that they can think, oh yeah, maybe that could work at our school, or oh, we need to tweak it this way so that it could work in our space with our students. Ruth spoke to you about evaluation and the activities for effectiveness, and those we again have been, all the evaluation comes back to our committee and we meet on a monthly basis and even weekly as we're getting close to the Youth Champions Initiative to look at what we need to make certain happens and to honor the student voices and the feedback that they have given us. The investment of staff time is less intensive year after year, and that truly is the case, that as staff roll through it one time, they are certainly able to understand how it works, but we still are so incredibly thankful for staff who do come back more than 1 year in a row, because it is certainly helpful to us, and to have that knowledge of how things run is extremely important for us and for other new staff sponsors who are going to take on the role in the years ahead. Thank you very much.
When we asked the staff about what they liked best about the program, We heard from them that they felt that the program did successfully raise awareness about cannabis and vaping. It did lead to more open discussions, and it did lead to increased knowledge among students. They did feel that students did increase skills like assertiveness skills, conflict resolution skills, decision-making skills, presentation skills, public speaking skills, interpersonal communication skills, and they felt that they demonstrated teamwork, collaboration, and socialization skills. They also felt that student involvement delivering the content was successful because youth reported feeling included, welcomed, and motivated to participate. Staff reported that students felt that the non-prescriptive role of the program gave them the freedom to implement it creatively. They also felt that school boards played a key role in recruiting schools and staff leads. They felt that public health, our approach in focusing on education over enforcement, made the programs successful, especially creating engaging games and activities that just drew students in, and having a celebration that gave a chance to have evaluation, gave a chance for the youth to learn from each other, that retained the youth champions, and as I said before, maintain momentum. So in terms of the milestones of the project, just to review, in 2019, the school boards identified cannabis and vaping as a concern to public health. Public health was able to obtain funding. Public health then proposed a partnership to co-develop a peer-to-peer youth engagement youth champions initiative with each school board. The proposal was approved by everyone for implementation in the 2020-2021 school year, and then COVID happened. So it was paused during COVID, and then during 2022, we revisited it with the lens of how has COVID affected the mental health of students. So we revised the content with that in mind, and year one was in the 2022-2023 school year. At the end of that year, based on feedback, we revised the content to add additional cannabis, vaping, alcohol, mental health, and well-being content. At the end of that school year in 2024, we got more feedback, and so we revised the content to include additional non-legal substances and additional health and well-being content. Then at the end of the 2024-2025 school year, just recently, we revised again based on the feedback that we received, and we included stigma, addiction, cessation, overdose, the Good Samaritan Act, and a greater focus on opioids. And as Heather mentioned, we have come to the end of the cannabis funding, and our school boards have very graciously taken over the lion's share of paying for this initiative and coming up with creative ways to run it. And yes, that's been wonderful. So we'd like to leave you with 3 takeaways. Number 1, school boards want and value public health assistance achieving their goals. We both have the same goals, reducing the harms of youth substance use. School boards want peer-to-peer initiatives. School boards have access to messaging and resources and students that public health doesn't have access to. And as Heather said, hopefully we provide them with messaging and resources that they don't normally have access to. It's such an ideal partnership that way. Number 2, the Youth Champions Initiative provides an opportunity for public health and school boards to develop long-term and meaningful partnerships on a variety of projects. So in addition to the Youth Champions Initiative, we've been able to partner on all kinds of things, such as curriculum development, resources and presentations for parents, resources for administrators. And developing and maintaining those relationships has been such a fantastic, unexpected outcome of the initiative. The third point is let the school boards do what they do best. So be open, be flexible. Let school boards determine what works best for their school and their culture. Don't push, just listen. Um, it's their schools, it's their students. So focus on being invited to the table, not controlling the table. I My approach has always been the deciding vote. Once we've received approval for something internally from public health, the final decision goes to the school boards whether or not they want to do something and how they want to do it. So thank you, Tanya and Heather, for helping me today with this. And now I think it's time for our Q&A.
Great. Thank you so much, Heather, Ruth, and Tanya, for an amazing and very detailed presentation. So we will now move on to the Q&A portion of our session. And just a reminder, if you haven't already done so, you can go to the Q&A pod at the bottom of your screen and enter any questions you have. And I do have the questions that we received prior to the session through the registration. So I'll be incorporating those into our panel discussion today. And I just want to remind everyone, we will use the allotted amount of time left and based on the questions we have. So we will do our best to answer all the questions that have come through. And we'll just get started with our Q&A. So probably no surprise to our presenters, there's a number of questions that are all about the youth and how we recruited them and those sorts of things. So I'm going to start off and I'm going to throw the first question over to Tanya. And what are some of the methods that were used in your school to recruit youth champions? And then we can pass it off to Ruth and Heather after if there's any additional items you want to add. So Tanya.
Yes, thank you for the question. Because I work closely with the Safe Caring and Inclusive Schools Committee, that's where we've gone to recruit our youth champions because I work with that group and I'm familiar with them. And so it's quite a large group with quite a mix of grades and backgrounds. And so I just come in once we hear that the program will be running again, and I share some information about the program, and then I ask for volunteers. We were able to bring 4 volunteers this year, 5 in the past, and those who have been trained in the past can continue to support, but we do try to train new students every year. And yeah, so they volunteer, which I think I touched upon is really important because we want them to be really engaged and enthusiastic about the program. So maybe Heather can talk about what some of the other schools have done. Thank you.
Thanks so much, Tanya.
Absolutely. I think the safe, caring, and inclusive school angle is an excellent angle because every school should have a safe, caring, and inclusive school team. We also have wellness teams in our secondary schools, and often our young people are coming from wellness teams. This is a newer initiative in the WRDSB, and that has certainly been an excellent way for our young people to learn another aspect of wellness. We also connect through our child and youth workers, and I think there was a question regarding students who might be more in risk, and then maybe kind of answer that tied into this. And child and youth workers are able to put forward some names of young people who might be more in risk in wanting to learn more. And in fact, this year we're going to have a cool new cessation group at one of our high schools, which I think is fantastic, coming out of our Youth Champions initiative. So there were young people who said, is there a place or a space for us to talk about cessation and what does that look like? So lots of different angles, and I think every school board probably would look at it in a different way.
And our Catholic board, they had a slightly different approach. They worked through their existing Safe Schools ambassador structure. And so their staff leads nominated students. And like Heather was saying, they were looking to nominate those who reflected the diversity of their school community. So they were wanting youth who had lived experience, natural peer influence, natural leaders, or perspectives that weren't always represented in leadership roles, not always those students who got chosen to be on council. And I think a lot of that happened in the public board as well.
And so just to follow up, and it can go to any of the three of you, but were there specific strategies for recruitment, specifically for those that maybe aren't the more typical keen and wanting to engage in this type of activity? So what sort of strategies? Now, Heather, I know you mentioned working with social workers, but is there anything else? Like, for example, Tanya, did any students approach you that weren't part of the safe school group that wanted to participate, or peer-to-peer recommendations or other teachers involved? How did you engage or recruit others who may not be like the typical student who would want to volunteer for such an activity?
Yeah, we do. So one of our child and youth workers is actually part of our Safe Care and Inclusive Schools Committee. We have a large staff presence in that committee as well. So um, a lot of the students who come to this, they could be very quiet. They could be on the margins. It could be because they've had lived experiences and they do want to see that the school become a more safe and inclusive place. It's not always just our typical leader who are in our leadership programs who join our committee. Often it's students who are also looking for a community, and so they know that this is a really safe community to join. And so I feel like we get a really great cross section of students. And yes, they're enthusiastic because I think they feel passion and that they're able to help educate their peers, and we give them that voice in order to run the programs that they want to run. And I also feel that they're always looking for ways of how do we reach new demographics of the school population. And so last year, they really wanted to make sure that they got into the MLL, which is our multilingual language learners classrooms, because they can't always interact in the same way as some of the other students. And so, they really took a look at how can we take this initiative and make sure that it's accessible to our MLL students. They wanted to go into the grade 9 phys ed classes because they know if we can capture them, especially if they're starting to deal with some more pressure that they haven't experienced before, now is a really great time to try to reach them. But they're also in the front foyer during lunchtime, so that all the and the lineups for these games, like it's just it's incredible, and all kinds of students are coming to participate, and it's very low risk because it's fun, it's interactive, and they get a prize at the end, but there's also learning that takes place. And so I do feel that we're doing a good job at trying to reach students who are at risk, but of course we're always open to feedback and learning new things. Thank you.
Thanks so much, Tanya. Heather or Ruth, do you have any other pieces you want to add to that? Any other unique experience at maybe some of the other schools?
I have heard of one school where the teacher approached a student with lived experience and said, I think you would do a great job at this. So the student didn't come forward, but she literally went and pulled that student aside.
And other students have asked about, as they've come in contact with youth champions in other schools, asked about how to get involved. And I think that's been wonderful as well. So when staff advisors are in the space with the students, then students can know how to get involved in the following years. Also, staff that come to some of our MH lit mental health literacy PD sessions, we all often let them know that this is a program that we run annually, and are always looking for young people who might be interested. So the more that we can get it out to staff in different areas and different venues, then they can take it back to their schools as well. But I think the peer-to-peer piece is really fantastic when they see each other doing it in schools and others coming forward because they'd like to be involved as well. And also having older students in our younger schools, right, is a great way for us to have kids who get contact with youth champions while they're in grade 7 and 8. And then when they come to high school, like, oh, I remember seeing you when I was in grade 7 and 8.
And I think recruitment gets easier over time too, because what I've noticed is that the number of youth champions increases each year, as do their range of activities and events. So yeah, it's that they're seeing they have a presence, they're running these activities, and they're doing the recruitment themselves without even trying.
And just to add to that, Heather, I remember there was a feeder school that was experiencing a lot of issues with students in grade 7 and 8 who were vaping and experiencing with experimenting with drugs. And so they asked Heather if she could bring the youth champions into the feeder school, so the grade 7 and 8 classrooms, in order to try to catch them before it became an even bigger problem. And so I think that was a very successful um, experience for those youth champions and then the younger students as well.
And that happened in 2 sites, I have to say. And just a great news item is that that particular school that you're speaking about has seen a dramatic drop in the use of vaping and cannabis in their school site. So thanks to Youth Champions Initiative, that school is feeling really different this fall.
So one last piece on the youth champions. The other piece was, so we recruit them, they're engaged, and then how do we keep them engaged? So are there other incentives for them? Like, do they get volunteer hours? Are there other aspects that help to support keeping them engaged beyond just the interest and involvement in the school community piece? Tanya, I can start with you.
Yes, that's a great point. They do get volunteer hours because this is always on their personal time when they are planning the events. It's often during over the lunch hour, or it could be after school. And so they can get volunteer hours for that. And even when they're going during class time, we give them volunteer hours because they're having to make up for the time that they've missed and do the catch up on their own time. So that's some incentive. But I do want to say, the buzz that they get when they have participated, and both Ruth and Heather have seen that as well, when they have run an event, especially the first time, it is so joyful because they are so enthusiastic. And I think to see that they can interact with their peers and have this really positive interaction with them, and it's like they're on a high afterwards because it's just so powerful for them. And I think that is incentive enough for them too. They just want to keep, because it's not like they tell us at the beginning, you must run 6 events throughout the year. It's that they do an event and then they're just so inspired that they keep going. So it's been the way the program is set up. I think the incentive is sort of built in just organically, which has been really great.
And I know the schools do a fantastic job about working around student busy times, like exam times, and also just however many activities they want to do, that's how many. So there isn't that pressure. It's not, they do a great job of it not feeling like they're taking a class, right? They're not getting tested. They're not, it's not going towards whether or not they're going to get into college or university, right? So they can really just have the freedom to participate as much as they want.
But that's a good point, Ruth, because we also do tell them that it looks really great on a resume. And if they are applying to post-secondary, to be able to say that they were a youth champion and then to be able to share some of that program is another incentive. But it also looks great on a resume just for applying for their first-time job as well. And then we become references for them as well. And I will say they also do love the food. Heather touched upon that, the breakfast and the lunch. That is incentive to go and to get trained, and then the celebration at the end is always really lovely as well.
Thank you, Tanya.
For sure. Food is always helpful, especially when working with young people. So to go more into like the content area, so you mentioned the youth really take a leadership role in planning. Are they also involved in deciding the specific topic areas? So you had mentioned, obviously, when it started this whole program, the focus was on vaping and cannabis. There was mention around mental health and stress and other aspects. So I'm gonna maybe I can start with Tanya or Heather. I guess what's the approach? And I know this will differ obviously school to school, but what is sort of the approach and how the topic areas are selected for any given year? And is there opportunity, for example, and I work in tobacco, so I'm going to pick on nicotine products, but when there's new products or other issues that arise, that topics or activities can be shifted or modified to respond to a need in the school at the time. Tanya, I can start with you or Heather, whoever would like to start that conversation.
I've just noticed throughout the 3 years that the program is constantly changing and evolving based on the feedback from the students, but then also the changing climate in our society. And so definitely new topics are being added. The students, when they're planning, definitely like the students I've worked with, they'll look through the questions, and the questions that they feel will be impactful or ones that they don't feel will have as much of an impact on their peers, they might take those ones out. But they're certainly looking at the topics of vaping, alcohol, and then the weed and drugs, and then the mental health and well-being. And that new bingo game Ruth touched upon that came from students that were running that has been a really nice addition to the mental health. We also run one of our events at our mental health and wellness day, because I know there was a question about that. And so the whole day is focused on mental health and wellness, and the youth champions would set up their events at that particular day so that they could be part of that. But it's just always trying to evaluate what is the need right now within the school.
There is a planning tool that's given to the youth champions, and it lists the different topics. And so they can always refer to that as well, just to get a refresher course on the different topics. And it also lists the different games and the resources. Um, and there's no directive in terms of you have to do this. I think Tanya said it well. It's they decide what questions and what answers they want to focus on. And the same thing with the posters. We give them a whack of posters and they decide which ones they want to post, where they want to post them. When they set up for an event, they decide what game they want to use. They decide even what prizes. And that's where that creativity comes, where I just go, oh, I never would have thought of that. Yeah.
Yeah, and
Yeah.
just sorry, Heather, go.
No, go ahead,
Okay.
please.
Just to add to that, last year, the youth champions at one of our bigger events, they had decided that they would really like students. They wanted to give students incentive to answer more than one question or participate at more than one event, so that they could feel that they are really learning as much as they possibly can. So they created this little stamp card, and then if they went to 3 different stations, they'd get a stamp at each station, and then that would be entered into a draw for a prize at the end. So it was just, they're trying to think up ways, how can we encourage them to extend their knowledge beyond that first game? And that all comes from the students.
And then those pieces that are developed by students at the end are shared with the other groups at the celebration. Is that typically what happens? Okay.
Yeah. And I want to just highlight a few of the changes. So the intersection between wellness and addiction became a topic that was really important and implemented a couple of youth champions ago. Refusal skills was another really big and important topic for our young people, and that became a new topic. And first aid, what do I do if I see a friend who's not in a good way? What can I do to help them out? So some really fantastic transitions for sure over time.
That's great, Heather. It was actually another question that had come up is like the first aid piece, or if they have heard from either an individual or a friend of the individual, if there's like any concern around substance use or mental health, if the students have training or supports on, I guess, the right way to address those and the right, I don't want to say protocol, it sounds so formal for students, but like the right process they're supposed to take in those events. So do they have training around that, especially when we're talking about mental health and substance use?
What I can say is we provide them with posters from Health Canada on the recovery position. And then I think the other piece is that they're given a list of community resources, who to refer to. And they're very clearly told that they are not responsible for solving a youth's problem. Um, they can share information, but ultimately, whatever a youth decides to do is their choice, right? And so that they know that the goal is to have conversations, share information. Um, and if we don't want them to be in an adversarial position. So it's always blame public health. We came up with the messages, it's just their job is not to make someone quit. Their job is not to stop substance use. Their job is just to have conversations and share information and have fun while you're doing it.
And I know,
Great.
Ruth, that was one of the pieces of feedback that I think our first group gave, is that they would like some more information to be able to have for students who needed it. And then right away, Ruth was able to compile a resource that we would have at the table for them. And then the students could suggest that they take some of that home in order to learn a little bit more. But of course, they're not forcing them to, but all of those resources are there for them at the tables.
And you mentioned most of the interaction is obviously peer-to-peer within their own school. And then there's some examples going to feeder schools, so grade 7 and 8. And then there was at least a few, I think, Heather, you mentioned around interacting with parents specifically. Are there other schools that are looking at to expand to like connect more with parents or adult allies, whether within their school or even maybe within the community at a larger group?
Great question. This year we are going through the feedback from our YCI that's just happened not too long ago. And so we will, if we could, get back to you about any kind of more parent connections that students are making. But you're right to know that they are brave and are certainly putting themselves out there to speak to parents and provide information from public health as well to parents. And if we see any new pieces coming this year, we'll let you know.
Oh, great. Thank you. Yeah, that is a big interest. I mean, there's a lot of conversation. I mean, peer-to-peer is obviously very important, but the role of parents and adult allies in young people's lives is also very important. And sometimes having that delivery or education from young people themselves also is like a helpful tool. They have a stronger voice than they think they have sometimes, young people. So I think it's great. So I know if there is, I think I don't want to speak for everyone on the call or the community, but I know public health would be really interested because that's an avenue we're always looking at of how to better communicate with parents and how to support young people in communicating with the adults in their life.
Yeah, I can tell you that at those grade 8 nights, what will happen is a lot of those parents will bring that grade 8 student who's coming the next year. And I heard from one parent say that their child decided to go to that high school because of a conversation that they had with that youth champions, that they felt safe. They were a youth of color, and the youth champions was a youth of color, and that in that conversation, she felt like this school is going to be safe for me. And the youth champion did a phenomenal job of saying, we're here. Here's what our committee does. Come to us if you have any concerns. Really laid out what their school does to help students feel safe.
Thanks for that, Ruth. That's great. I could see how because it's that transition to high school can be very challenging for many and daunting for child and parent. So, seeing someone or knowing that there's supports at the school, I could see how that would be very helpful. So we're actually going to zoom out a little bit now from like the specific programming and there's some more general questions about the number of schools that are involved in the initiative, a little bit more around funding. So you had mentioned funding was limited or has in terms of the provincial funding is C. So how does that sort out? So let's start with just the general counts of how many schools are involved. And do you expand the number each year, or is it just based on interest across your school board? I'll start with you, Heather, and then Ruth, maybe you can speak to the Catholic board if you have that information.
Sure.
Great. Yes, it has expanded as each year we have progressed from small to 12 of our 16 composite high schools this year. So that is pretty fantastic. We're very happy and hoping that we can see all 16 join next year. So those are and each school brings 5 students in terms of transportation. Of course, we think about costing, and bringing one small group of students at the moment is how it's working. And those students are again affecting so many students in their schools across the Waterloo Region District School Board.
That's amazing. Ruth, do you have the counts from the Catholic board?
With the Catholic board, they have about 1/3 the population of the public board. So they have now 6 high schools, and all 6 participate. They're a little different than the public board. It's an expectation of being part of the other programs that they lead, the Safe School Ambassador program. But that being said, um, they're also in a different position in terms of being able to transport. So they are able to get school buses. So they don't have the 5 students per school limitation. And so at our last one, we had, I think it was 90 youth at our last training for 5 schools, and another, I think it was 15 staff. So I know that technically it says it's mandated, but the way the program's running, I feel like, okay, they're having a great time. It's growing. So um, uh, I would say that it's really well received. And that's the feedback we get from staff. We've never got any feedback that, well, I mandated and this is really hard for me to do. Because we do have an opportunity for staff to give very anonymous feedback, and we haven't heard that.
And then in terms of the funding, does each school get a certain amount, or say they wanted to do some kind of activity or event, do they have to submit for funding? Do they have a pot of money to kind of implement, or do they have to use the resources that they have available to them in the school? Tanya, I can start with you and then maybe go to Heather.
Um, because they have provided us with so many great resources during the training, and each year we have received more games, and the games are fabulous. And then they provide all of the prizes, the booklets. So all of the resources that we need to run our events and activities, I've never felt as though we needed additional for extra cost. The only thing I will say is there have been times when I've asked for Ruth or Heather to step in because I've been teaching. So if we're running an event during the day and I can't cover, then Heather or Ruth have been able to jump in and just to be that support for the students. Again, just the presence in the classroom, but they're still allowing the students to lead. So I would say that we're very well equipped from the training. And if we run out of anything, I know Ruth, I've been in touch with you in the past about could we get some additional prizes? Could we get some additional posters? And that's never a problem at all.
I can add on that most school boards should receive an emerging needs grant, and through that emerging needs grant, it has some specifications around vaping, cannabis, and substance use prevention intervention. And so this is a good way to support the Youth Champions Initiative in other boards.
Great. And then I know we talked a bit about in the presentation around evaluation, and there's obviously limitations for all evaluation in general, but even with this evaluation for this program. But have you noticed through obviously anecdotal conversation through staff, like at schools, has there been a shift in behavior? Have we noticed like a change? So for example, I know you mentioned one of the schools, they had a really big problem with vaping, and they noticed like a very significant shift in terms of having to deal with issues on school property. Are you seeing that across your schools? Are you noticing other comments from staff that aren't directly involved in the initiative? Have you heard any feedback in that respect on school property?
When we've run the activities within the classrooms, we've had really positive feedback from the teachers in terms of the reception from the students learning from the peers, in terms of anecdotal evidence as to what the difference it's made. I can't touch upon that, but I just had an email from one of our phys ed teachers because the students were in 2 Thursdays ago, and she said they were going into a larger grade 9 class and they were kind of changing how they were running things, and she said it was excellent. And they actually ran out of time because they will sometimes create resources too. They were going to have a Kahoot at the end, but they didn't even have time to get to that. So just the fact that the students are interacting so well even in class, the class time, I think is a pretty positive sign that the program is at least engaging them in the learning, because that our periods are 75 minutes, just so
Right.
there's an understanding of that engagement lasted for the full 75 minutes.
Which is a win in itself, actually.
Andrea Snyder, our mental health lead from the Catholic Board, she provided me with a summary and her closing comments. I'll just read them for you. Students consistently demonstrate compassion, creativity, and commitment to improving their school communities. Across schools, there is clear evidence that YCI strengthens belonging, enhances mental health and substance use literacy, increases help seeking, and builds student leadership capacity. And she also said that apologize, that it's really helped to reach their safe and caring schools goals of creating a safer, more inclusive school climate. And what the Catholic Board has done is they have created a YCI for grades 7, 8. They don't have the capacity to bring all grade 7, 8 schools together. That's an enormous number of schools. But what they created is a module that if a teacher in a grade 7, 8 school would like to run the initiative, then they got the materials to start it up themselves. So it's a very low cost way to run a program, and it's their first year doing it. So I think that speaks to the changes that they've been seeing, they've liked, and they're also hearing, like Tanya and Heather said, that you need to start earlier.
I can't imagine that over time it won't just continue to create a really excellent space for prevention. I remember being the first school to bring home, a pilot school to bring home the blue box many, many, many years ago for recycling. And, over time, over information and prevention, of course, everyone began to recycle. And I think that we are going to be seeing that. We have seen in 2 of our schools a significant reduction, and we can hope that that's because of the information that students have received through public health and through our youth champions in their schools. Most certainly. And I think, prevention, safer use, intervention, sensation, and help seeking are certainly the places that we're looking to see growth over the next little while here in the WRDSB as well.
But if I can just add, though, I really wanted to highlight the role of what the mental health leads and the CYWs, that whole piece greatly contributes to reductions in substance use. So it's public health, but the really big piece is addressing mental health, addressing coping, addressing resiliency, right? That's why it's such a great partnership.
Great, thank you. So we have a few minutes left. I think we covered most of the questions, but I wanted to ask one last question to everyone and we can go through. But a lot of people expressed interest in potentially getting something like this program started in their local community. So if you could offer one, if you can't stick to one, a few, top 3 pieces of advice for someone starting out, and it could be a lesson learned that you had or just a suggestion or a recommendation for those starting out. So I'm going to start with you, Ruth.
Put your money in games and prizes and teacher release time and make it fun.
Great. Heather.
Have some central staff that's ready to support your teachers. The teachers are certainly so important and they support our incredible students. So this connection between community, schools is just really essential, and it's going to make all communities a safer place to be.
And Tanya?
I think just trusting that the youth are able to achieve really wonderful things. And when we empower them and give them that ability to make choices and to come up with ideas and to feel that we trust them in order to interact and help to educate their peers, then magical things can really happen.
And Jonathan, I know you haven't had a chance to chime in yet today, but if you had any last minute thoughts or anything you wanted to add.
Sure. Yeah, thank you. I think that public health has the subject matter content expertise on substance use prevention and youth well-being, but the school boards and the schools know their community, they know the culture, and um, really letting the school boards and the schools take the lead on what works. Um, and we can provide the content to kind of help with that. But I think just not imposing on ideas on what public health thinks might work for schools, but to allow the schools to say what would work for the community. And I think that's one of the most important things for this initiative and why it's successful.
Can I add a second point?
Sure.
I was just thinking that um, oftentimes we think of a partnership is you develop every single piece of paper, every file, everything together, and the school boards don't have time for that. Teachers don't have time for that. So public health, do as much creation work as you can. Let the school boards review it and have feedback. Let them participate to whatever level they're comfortable in, but don't drown them with the development piece, right? Let them put their time where it's most important and yeah, just do a lot of the background work.
And if I could just mention one additional, just anecdotal information about this project, was we've been running the partnership with the school boards in the Youth Champions Initiative has been running for a few years now. And there was a student that had graduated from a secondary school, had reached out to us after the fact and mentioned that they had gotten a job that was health related and educating youth, and they said that it was their experience and their leadership that they did as a youth champion that inspired them to pursue that career goal. So I thought that was a really rewarding information to hear after the fact.
And Tanya, that was one of your students.
All right, so I'm just looking at the time right now. So I would like to thank everyone on our panel and presenters today and everyone who attended the session and added in questions. If we didn't get to one of your questions or you have one following the session, Jonathan has agreed to for anyone to send any emails to him and he can help support answering any and all questions about the program for you. A big thanks to Heather, Ruth, Tanya, and Jonathan for helping to put this webinar together and this great discussion period. I would like to send a thank you out to all of you who joined our session today, and your time and active participation are truly appreciated. I can't also forget our events team who's behind the scenes, who you cannot see, but they've been supporting this session prior to and live during the session. And just wanted to note that you will be receiving a brief anonymous survey following today's session. We encourage you to take a few moments to complete it, as your feedback is invaluable and it helps to strengthen future programming, topic areas, and other webinars in the future. And thank you all again, and I hope you have a great and wonderful day. Thank you.